I'm Dr. Navin Nikam, an interventional cardiologist with Heart and Vascular Institute of Texas. We know COVID-19 can attack the heart, damaging your heart muscle and causing blood clots. So don't ignore your symptoms. We're here to answer your questions and help protect your heart. I think we are just at the cusp of the beginning, though. There's a lot of data that suggests there's a lot of people who are having some involvement from a heart standpoint, let alone the other issues that manifest in heart disease, as well as lungs and blood vessels and other issues. So we expect at some point for more people, both with mild and severe episodes of the infection to COVID, to manifest with concerns with their heart. So, right now the main concern is just their overall safety and their risk. And, that's a very individualized process. So it's real important that we understand the person and develop that relationship. And then we can kind of answer some of those questions. And then as we move forward, I think that conversation will change for some people, like we said, as we start to see, who does or doesn't have heart symptoms in relation to the potential infection. A lot of what we have had to deal with so far is the acute phase with people who have become really sick. And viruses can affect overall heart function and can cause both heart failure or irregular heart rhythms. And these symptoms can contribute to some of the respiratory and lung-related symptoms that people can have with the high inflammation from viral infection like COVID. So it's, working with those people, the people who have had milder episodes that, we're just learning about, we're still kind of seeing what's coming up with that, whether it's, just feeling short of breath or at risk for irregular heart rhythms or something else. I don't think we have enough information yet or experience, just haven't had enough time yet to see those people or for them to have developed any symptoms or concerns in a strong, in a clear pattern, in our city, state, or country. So I think more will come in the next 6 to 12 months as we start to, more people are just exposed to the infection. It's really important in this time of COVID that we don't lose sight of the other issues that affect the heart. And that was back to the primary prevention and a lot of those risk factors. COVID is a very big concern in the medical community, obviously, and our elderly patients with risk factors as well. They're concerned for themselves. And so along with that, though, we want to make sure that we're just taking care of the routine risk factors for heart disease that can lead to, typical cardiac problems that can develop over a lifetime. So we want to make sure that those are being addressed, that those concerns are managed appropriately, safely. And we're here to help take care of that. So, we want to be available and be there to help patients in any way they need it.